Hello and welcome. I'm Kristi Addis Hickman, and today I'll be hosting a discussion for Elite Public Image. We're going to be talking about healthcare disparities for minorities in America. I am particularly interested in this subject as I am part of an interracial family. My husband is African American, and we are raising 2 biracial daughters. And it's a pleasure today to have with us to discuss this Dr. Meliss Liang. Dr. Liang, welcome. Dr. Liang is the Director of International Operations at the Cleveland Clinic, and she's also a practicing endocrinologist. I really look forward to what you're going to be able to share with us today, Dr. Liang. And also, we're excited to be having with us a musician, rapper, and anti-bullying advocate, TonyWHOA. Welcome, Tony.
Thank you. Thank you for having me.
I'm looking forward to hearing what both of you have to share with us today. And I'm just going to jump right in and start off with you, Tony. Do you believe that you've had disparity in the healthcare system, that you've experienced that just simply based on the color of your skin?
Oh, yes, definitely. Me, my family as well.
Wow. So, and you feel very confident about, that it was based on your race alone. So, and even your family. Okay.
Yes.
And we know this is not uncommon. And Dr. Liang, I know you feel strongly that on the other side of the fence as the healthcare worker, that you see this as well.
Yes,
what
I
are
do.
Your thoughts?
I do see healthcare disparities in our system that translate to different outcomes based on race and ethnicity. And, our COVID pandemic really magnifies the disparities that we have in this country. I could show you some of the data from the CDC, which shows a marked difference between the rates of hospitalization for minorities, particularly African Americans, Hispanics, and American Indian or Native non-Hispanic persons. So when we compare this to white non-Hispanic persons, the rates of hospitalization and death are much higher.
Wow. Wow. And so what do you think the root causes of these disparities are for minorities?
Well, when we take a look at access to healthcare, I think that this is where the systemic problems are, where minority communities have greater difficulties accessing healthcare. That would include transportation, work schedules, even healthy foods, where you don't find healthy grocery stores in many of the minority communities. And so even when we take a look at health outcomes of African Americans have a higher prevalence of chronic diseases such as high blood pressure, diabetes, and stroke. And they also have these diseases at younger ages, and they're more likely to die at early ages from all causes. And this doesn't have to do with individual behaviors, actually has to do with how our healthcare system is set up. And really, I think the call for healthcare providers as well as for the system is to recognize these differences and to figure out ways to get rid of these disparities.
Wow. I would say these statistics are staggeringly concerning. I don't think most people would be aware of, the hard, cold facts when you look at it in statistic form. Kind of putting a story behind that. Tony, why don't you share with us a little bit about your personal experience that puts a face to this, really?
Okay. Well, my experience is, up north in Indiana, I had a real cool Caucasian brother, for a doctor, and unfortunately, he passed. And so I was shuffled to the next doctor, the only one who had, room in his roster of patients. And from the onset, I mean, he was arrogant, rude, and very condescending when he spoke. And all of our conversations, just basically ended with take your medicine. All of my questions would be answered with take your medicine. And I'm like, I am taking my medicine. I don't, get these responses. So one time when I was sitting in the lobby, I asked a few of the other patients who, had him as a doctor, and, they were all saying that he was very kind and very nice and very caring. And, I happened to notice that there was a tad bit of a difference that, they were all Caucasian and I was the only African American in there at the time. And so, I thought, well, maybe it's just me. So, I, go in for another conversation. And I had been watching, different shows like The Biggest Loser and Celebrity Fit Club and things like that, and seeing where, people are able to lose their weight and they, come off their medications. And I was on medication for pre-diabetes, hypertension, and high cholesterol. And so I'm asking him, is it possible, if I lose this weight, can I come off this medication? And the look of disdain that was on his face was just heartbreaking. I mean, he just looked at me like I was nothing. Like, you're not going to lose this weight, so shut up and take your medication. And it really just broke my heart, because I felt like, okay, in this battle, I was alone. I'm by myself. The doctor doesn't care, and I'm just kind of trapped. And I don't know, what I can do. Can I get off the medication? I don't know. And it just, made me sink more and more into a dark place.
I am so, it hurts my heart to hear your story, your situation, and you having to experience that. I can't help but think about members in my family and my husband's family. His uncle who passed away recently this past year, complications with diabetes for years. My husband's father passed away 6 months later, diabetes, both African-American men. And I'm so glad that we're having this discussion. I can imagine being in that hopeless place and not having someone to lift you up, to care, to want to help you be motivated. I'm sorry that you had to look to the TV, The Biggest Loser, instead of having someone right there in the doctor's office to help you, to motivate you to be, that's sad. I'm really glad that we're having this discussion. I know the statistics that you showed earlier, Dr. Liang. Can you talk a minute about just the misconceptions that keep the status quo, keep promoting this, as Tony was saying, well, just take your medicine?
Well, I think there are common misperceptions in this country in regards to minority behavior. Tony, thanks for sharing your story and really putting yourself out there. It's unfortunate that your story is actually quite common, and it's repeated 100, 1,000, 1,000,000 times every day across our healthcare system. And so some of the common misperceptions is relating certain behaviors, such as taking medicine, right? Medication compliance, which is what the medical professionals call it. And basically labeling a whole group of people as being non-compliant. And so, if we were to consider certain minorities not wanting to take their medication or being hesitant to seek medical care, those would be misconceptions that we would put on African American men. And we have to really understand the reasons for those misconceptions and really fight hard to dispel those misconceptions, because it really doesn't help African American men to be healthier, and it doesn't help our society to have a healthier population. There are misconceptions, with Hispanic women and with Asians in terms of diet and exercise. And so, labeling groups or stereotyping is very dangerous in the healthcare system, because it really doesn't move the needle in improving health.
Well, I'm glad that I know the rest of the story, so to speak, with you, Tony. And I know you moved and you're able to kind of fight through and struggle through this experience. And I want to hear a little bit now, some hope of what can happen as we have people like you that will continue to fight their way through, and hopefully conversations like this, you can help inspire some people with something I know you can share with us.
Excellent. Yes, I moved to Florida about 3 years ago, and when I found my new doctor, he was an Indian brother, and when I walked in the door, I mean, he shook my hand and put his arm on my shoulder, and he smiled at me. He was very kind. And after he read all of my charts and had all of my information, he sat me down and he was like, Tony, you're young. He's like, we can fix this. We can get you off of this medication. We can help, we can heal you and get you back to where you need to be. Let's work together and make these changes. And we did. It was amazing. Over the years, I've gone from, I think I came down at 246 pounds. Now I'm 172. I was size 40 pants. Now I'm a 32. I was a double X shirt. Now I am a medium. And I lost 9.5 inches of belly fat, which is very uncommon, in our community, because we're just kind of pushed into negative land. But when you have somebody that's working with you and not just telling you what to do, not just telling you to go take your medication, but actually like walking with you hand in hand, someone who's excited to see you. I feel great, going to the doctor now, from the nurse at the front desk to the nurse that takes my weight and everything. And, we laugh and joke about what it used to be. And then I get back there to the doctor, and he's like, another family member. And I'm, just happy to, come to my brother's house and have him treat me so kind. And I wish he had more space, because I would tell everybody to go over there and see him and be part of that. But I mean, like, he helped me. He walked with me and helped me change my life. He didn't just leave me out there on my own. He actually cared about me, and I could tell, I could feel it, and even now during COVID, when we do our teleconferences, it's almost like talking to a family member. He's just so happy to see me, and I'm happy to see him. So change can happen when the right circumstances or the right people are brought together.
That is so inspiring. That is so, so inspiring. They need to film a whole TonyWHOA episode for The Biggest Loser. That they don't know. They don't know. You need your own episode on there. That is so inspirational. It is encouraging to hear. And I know there are there are some amazing public servant hearts in the healthcare system. I know my sister works in the healthcare system, my brother-in-law, and I know there are people like your doctor, Dr. Liang. And so for you, Tony, to the healthcare workers out there, what message would you have to give them to help them just keep helping people, or even know how better to help people?
Kindness and caring goes a long way, Kristi. And I always see things like, you know, when you're interacting with people, you have two roles. Either you're the villain or you're the hero in the situation. And medical professionals, you know, like my doc now, like Dr. Liang, you know, are the heroes. You actually save lives, you know, and people appreciate that, and we need that. So I think that if you focus more on the kindness and the love that you show people, I mean, literally treat people like you would your grandma. Literally treat someone like you would your mother. You know, that's how my parents raised me. You know, you better treat every woman as well as you treat your mother. You better treat every man as well as you treat your father. You know, that was mandatory. And, you know, I try to have a smile on my face for everybody that I meet. And, you know, it always feels funny when someone doesn't like me, because I'm like, I really tried to get on your good side, but it didn't work. So I think with, you know, medical professionals, if we focus on, you know, trying to be the heroes in people's lives instead of the villain that brings you down, I mean, wow, what a country this would be. Think about all of the people who need heroes in their lives like that. You know, someone to step in and let them know that, you know, these foods that you've been eating are not working with you. You know, the lack of exercise, or the, you know, just everything. You know, we need help everywhere. Sometimes somebody just needs to hear a kind word to boost them up, some encouragement.
Thank you, Tony. Thank you so much. I do appreciate, like Dr. Liang said, your vulnerability of just, you know, sharing your story. Dr. Liang, what can the healthcare system do to address these concerns that he has been talking so passionately about today?
Well, I think that the healthcare system is recognizing that racism is a public health crisis. A systemic racism in our healthcare system is a public health crisis, because we are not treating a large portion of our population the same as another. And that leaves our society with sicker people, a less productive workforce, and unhealthy children. And so I think the healthcare system right now is being more intentional and purposeful in improving the diversity and inclusion, particularly at the leadership level. You know, it is so encouraging to hear Tony's story of empowerment. He met a doctor who believed in him, who empowered him to make changes, who didn't hold to some misconceptions because of his skin color, and reached out and treated him with respect, like a fellow human being. And I must say that I'm hoping that that is an increasing set of behaviors across our country. But not only just individual behaviors, but that systems really reach out to communities that have been marginalized throughout this country's unfortunate history, and particularly with race, to really reach out and empower those communities to trust in the healthcare system, to come to the healthcare system and expect to be taken well care of.
And so what would you say then, Dr. Liang, to a patient that is in his shoes presently, that might be watching, that's feeling what he is feeling? What would your words be to them now, while we're going through the process, maybe not there yet?
Well, one, certainly with the first physician that Tony had, I would have encouraged him to speak directly to that provider and really confront the provider as to whether the differences in how he was being treated is related to race, it's related to his skin color. And if some of those conversations don't lead to any progress. There are other avenues to which patients can bring their concerns to. You can go to your local health departments. Every hospital does have patient advocates to speak with in terms of really not penalizing people, but really trying to change the system, really bringing these issues to the light. Because if you know, Tony isn't the only one who has experienced this type of different treatment because of his skin color. So to bring it to light really will help other people to feel empowered to bring it to the light and to change the process and the system.
So as this process continues, how will we know when and if we are making headway, that it's changing in the healthcare system? Dr. Liang.
Well, I would say that we will know that we are making changes when those who are the decision makers, the leaders in healthcare organizations, in government, in our education systems, are diverse, where we have more minority representatives at the table making decisions. You know, very similar to a number of the strides that we've made for women. I don't know how men could make decisions for women if they haven't been a woman. And so, you know, intentionally bringing on women leaders has improved. This is scientifically proven. The data shows that diversifying your leadership, including women, including minorities, improves the productivity of every organization that has done it. And so for us to really move past some historical mistakes that the country has made and to move forward to a more inclusive healthcare system, we have got to be intentional in including minorities at the decision-making table.
I could not agree more. I cannot agree more. My husband and I are co-authoring a book on diversity and family, actually, presently, and we're raising 2 daughters. And so I couldn't agree more that the leadership positions need to be shared between minorities, between gender, and it does strengthen us. It's like Tony was talking about earlier, and he was using the word we. You know, I know that's what we all want. We want this to be something where we all feel well represented and well taken care of. And so I really think just the way that you shared your story, Tony, it's gonna help. It's gonna further that hope that we have by you sharing your hope,
Excellent.
your struggle, and then your hope, sharing firsthand the struggle in the healthcare system that you had, and then also the hero, you know, like you said, the superhero or the villain, you know, your experience with the superhero in the healthcare system and how that turned your life around and changed your life. And we can hear more stories like that. And Dr. Liang, the information that you share with us and just your expertise, your advice, everything that you've shared with us is so eye-opening, so helpful. I'm so grateful that you are in the trenches, so to speak, speaking out, and especially in your position. I know as Director of International Operations, you definitely have a voice there, not just at Cleveland Clinic, but well beyond that. And thank you for speaking up and for sharing that. And thank you for being here with us today. So we're going to close out our discussion for today. It was great to be with everyone. Our hope is that this brings awareness, that this can bring change, and that you can continue. If you're watching with us, you're viewing today, that you can continue this discussion with your coworkers, your friends, your family. And we hope that we will be a part in seeing change in diversity in the healthcare system. So thank you so much for being with us. And everyone, have a great day.